In case you have any of the following symptoms, you might be having a UTI, and the best thing, just go see a doctor. The first one is frequent urination. Now, when you have inflammation in your bladder, the muscles will be affected, so they will contract and relax quite often. So your bladder will feel like it's full, so you'll find yourself going to the washroom, so just go take a leak. Sometimes when you have an inflammation there, your blood, even if you have a small volume of urine, it might affect due to the inflammation that's already there. So the muscles, they will feel that you need to just take a leak. The second one is discomfort when you are urinating, which means that because your bladder or your ureter is inflamed, you might feel an itch. Sometimes you might feel that you want to scratch yourself, or maybe you have pain when you're taking out your urine, or sometimes you might have that burning sensation. The third one is having blood in urine. So your urine will look like a red, cherry red, sometimes pink. This is because of the blood that's already there. When you have an inflammation in your bladder, chances are high that you're going to have like a trauma there, and you're going to have blood in that urine, meaning that actually when you start seeing blood in your urine, it might be an advanced UTI, so it's high time you go get checked out. Although we have another parasite called Schistosoma hematobium that usually give the same result, you get blood in urine. Either way, you need to see a doctor. The fourth one is having pain in the lower abdomen. This is quite common in ladies because sometimes it's usually hard for them to realize that they already have UTI, and by the time they are realizing, it's a little bit too late. But for men, it's a little bit easier for them to notice that they have UTI unless they keep it late. So the pain in the lower abdomen will come by because the bladder is there, and because of the inflammation, the nerves that are there will be triggered. The fifth sign is having cloudy urine, which means that that urine is turbid. Turbidity will come in because the urine will have a suspension of cells, white blood cells, which are trying to fight the infection, the bacteria itself, and some of the epithelial cells. Because of the inflammation, some of them will be lodged into urine. So when you're passing out urine, it will clear all the pad, and all the debris that will be suspended there will come into that urine. So if you take a glass of, or a clear glass of that urine, you're going to see that that urine is opaque. So when you take that urine to the laboratory for examination under the microscope, you're going to see things that we usually call parcels. Those parcels will be combination of cell debris and white blood cells. Number 6, this is smelly urine. You have urine, and because you have bacteria activity, you are going to have some of those bacteria converting some of the compounds in that urine to something that's smelling. So your urine will not smell the normal urea smell. You're going to have some other funny smells. So that's a very, very good sign that you have bacterial activity there, and it's high time you go get checked up. Number 7 is a discharge. For men, this is very easy. If you have a discharge, you definitely have an infection. Now for ladies, sometimes it might be tricky because of the nature of their anatomy. Sometimes they might be having like just the normal discharge, but the one that's infected, sometimes it smells, might have some funny colors, like it's yellowish. And yeah, so in case you have any of that, you might need to see a doctor for a diagnosis. The final one, or number 8, this is back pains. You see, most of those areas will be connected by the same nerve plexus, so the same nerves network. Meaning that you might be having pain in your bladder, but it will be felt elsewhere because of the network. In case you have any of those symptoms, or a combination of them, or all of them, sometimes even some symptoms which are not listed, but you definitely need to see a doctor, go get a diagnosis and a medication for that, because sometimes when you keep UTI for long, it might lead to other complications. So the best thing for you is just rush to the hospital, get tested, and get the drugs for that. In case you're gaining value, kindly give us a subscription and also like the video, share to those people who will be interested, and see you in the next one.